Beyond fixing, the revolution in crisis response. What if everything we thought we knew about helping people in crisis was wrong? What if our instinct to fix, to solve, to make better is actually making things worse? I recently had the privilege of interviewing Yanni Prophet, a visionary whose 18 plus years in crisis intervention has fundamentally transformed how we understand human suffering. Yanni isn't just a professional with impressive credentials. He's a survivor who brings raw authenticity to this conversation. His work stands as a testament to what's possible when we dare to question our most basic assumptions about healing. Through his groundbreaking approaches, Yanni has not only saved countless lives, but has sparked a movement that is reshaping entire systems of care across the nation. Yanni's revolutionary insight is deceptively simple yet profoundly challenging. Our obsession with fixing people in crisis is often the very thing that prevents true healing. This paradigm shift isn't just changing systems, it's fundamentally altering the landscape of mental health support in America. The data confronts us with an uncomfortable truth. Our current approach to mental health crises is failing countless individuals, with particularly devastating effects in marginalized communities. When someone experiences a mental health emergency, our systems typically respond with control rather than compassion, containment rather than connection. The results are devastating: unnecessary trauma, criminalization of mental illness, and in too many cases, preventable deaths. But there is hope. Through Yanni's insights and evidence from communities implementing new approaches, we can see a path forward that honors human dignity while providing effective support. Let me share three critical insights that emerged from our conversation. First, multidisciplinary approaches are essential for addressing behavioral health emergencies. The traditional model of dispatching police officers or paramedics alone to mental health crises has proven woefully inadequate and sometimes dangerous. These single agency responses often fail to address the complex nature of behavioral health emergencies, resulting in unnecessary hospitalizations, incarceration, or situation escalation. Consider what happened in Memphis after the tragic death of Joseph Dwayne Robinson, a man with mental illness who was killed during a police encounter. The community's pain transformed into purpose as they developed collaborative teams integrating behavioral health practitioners, paramedics, peer support specialists, and social workers. These teams prioritize de escalation and appropriate resource connection rather than control and containment. The results: a 40% reduction in unnecessary hospitalizations and an 80% decrease in use of force incidents during mental health calls. The second insight that emerged from our conversation with Yanni is that creating safe spaces and respecting personal boundaries is fundamental to effective crisis intervention. When someone is in crisis, their need for physical and emotional space must be honored, not violated. Yanni shared the story of Marcella, a young woman experiencing a psychotic episode in a crowded emergency room. As security guards approached to restrain her, a crisis worker intervened, creating physical distance, lowering her voice, and simply saying, "I see you're having a really hard time right now. I'm here to listen, not to make you do anything." That simple act of respect, paying attention to body language, avoiding crowded environments, and maintaining a calm, non threatening presence completely transformed the situation. Within minutes, Marcella's breathing slowed and she began to communicate her needs. Research confirms what Yanni has observed in practice: approaches that recognize the dignity of the person in crisis rather than treating them as a problem to be managed lead to dramatically better outcomes. This isn't just more humane, it's more effective. The third transformative insight is that embedding crisis response within community health systems dramatically improves outcomes. The most effective models integrate crisis services into existing primary care and community health infrastructures. This includes training primary care providers to recognize mental health issues early and coordinate with specialists before situations escalate to emergency status. In San Antonio, this integration has revolutionized care. Primary care clinics now include behavioral health consultants who can immediately assist when a doctor identifies mental health concerns. This seamless connection reduces stigma, improves access, and creates culturally responsive care pathways that honor the whole person. Since implementing this approach, San Antonio has seen a 30% reduction in psychiatric emergency room visits and a 25% increase in successful connection to ongoing care. Mobile crisis response teams represent another powerful example of this revolution in action. Traditional crisis responses relied heavily on law enforcement, often with tragic consequences. In response, communities like Eugene, Oregon developed Cahoots, crisis assistance helping out on the streets, a team of medics and crisis workers who respond to mental health emergencies without police involvement. The COVID-19 pandemic dramatically increased mental health challenges globally, with the World Health Organization reporting a 13% rise in mental health conditions and substance use disorders over the last decade. This surge exposed the inadequacy of traditional crisis response systems and accelerated the adoption of mobile crisis teams. In Eugene, Cahoots now handles approximately 20% of all 911 calls, saving the city an estimated $8.5 million annually while providing more appropriate compassionate care. Most importantly, they've successfully diverted thousands of individuals from unnecessary hospitalization and incarceration, preserving dignity while providing appropriate support. Crisis intervention team programs represent another transformative approach. Without specialized training, emergency responders often misinterpret mental health symptoms as threatening behavior, leading to escalation rather than de escalation. In Houston, a tragic incident where a young man with schizophrenia was killed during a police encounter catalyzed change. The city implemented comprehensive CIT training for dispatchers and officers. Now, specially trained teams respond to mental health calls with remarkable results. A 40% reduction in use of force during mental health encounters and an 80% increase in successful connections to appropriate services. Perhaps most promising is the shift toward individualized crisis planning. Personalized crisis plans developed collaboratively with individuals at risk have transformed prevention and response strategies. Generic crisis protocols often fail to address individual triggers, needs, and effective de escalation techniques, leading to ineffective or harmful interventions. Comprehensive crisis plans now include thorough assessments of specific needs, explicit do and don't instructions for caregivers, clear immediate response procedures, and ongoing training for all involved parties. These individualized plans have significantly reduced crisis escalation and improved outcomes when crises do occur. The shift toward individualized planning emerged from recognition that standardized approaches often fail to account for personal history, cultural factors, and specific triggers. Organizations implementing these personalized approaches report dramatic reductions in crisis incidents and improved recovery times when crises do occur. If more organizations adopted this perspective that people in crisis need compassionate connection rather than fixing, we would see profound changes across our communities. The evidence suggests we would experience a significant reduction in unnecessary hospitalizations and incarcerations as more people would receive appropriate community based care that addresses root causes rather than just symptoms. This would particularly benefit Black communities that have historically experienced disproportionate criminalization of mental health issues. We would see improved outcomes for individuals in crisis as they would encounter systems designed to provide trauma informed care that respects their dignity and agency. Research shows that approaches prioritizing mutual empathy and respect lead to more sustainable recovery and healing. We would witness greater public trust in crisis response systems as communities would see that their most vulnerable members are being treated with dignity rather than as problems to be managed. This trust is essential for early intervention and prevention. So, where do we go from here? How do we take these revolutionary insights and transform them into action? I challenge you today to examine the systems within your own organizations, communities, and personal relationships. Are you creating environments where people feel safe to acknowledge their struggles? Are you building cultures where human dignity takes precedence over productivity and performance? Remember that crisis doesn't always look chaotic. Sometimes it's the colleague who never misses a day but is silently struggling. Sometimes it's the high performing team member whose smile masks profound pain. By shifting from a fixing mindset to a connecting mindset, you create space for authentic healing. The next time someone in your life is suffering, resist the urge to immediately offer solutions. Instead, simply say, I'm here with you in this moment. That presence, that willingness to stand in the gap between suffering and healing without rushing to fix may be the most powerful gift you can offer. This revolution in crisis response isn't just about systems change. It's about reclaiming our shared humanity. It's about recognizing that in our rush to fix, we've forgotten how to connect. And connection, deep, authentic human connection, is where true healing begins. The question isn't whether we can afford to transform our approach to crisis response. The question is whether we can afford not to. Lives quite literally depend on our answer. Will you join this revolution